There are a number of reasons why a patient may be considering knee replacement surgery. Ultimately, everything comes down to a quality of life issue. But when patients start to have pain in their knees and in their joints on a daily basis, and it's something that they're aware of on a routine basis, then it is something to be considered. If you have difficulty going up and down stairs, difficulty going for a walk around the block, difficulty participating in activities of daily living, you're afraid to go to the supermarket because you're unsure if your knee is going to support you. Those are reasons to consider knee replacement surgery. Patients who previously used to engage in recreational sports and they find that they're no longer able to do that because of knee pain may be a candidate for knee replacement surgery. Other issues are issues of being able to keep up with your friends, your family, your neighbors. If everyone in your family is going on a trip to Disney, not being afraid that you're not going to be able to keep up and participate in those kinds of activities. Other issues with regard to knee replacement surgery are issues with pain. And if you find that you need to take pain medication on a regular basis, then knee replacement surgery may be something to be considered. We don't want to manage pain with painkillers on a regular basis for a long period of time. That's not the right answer. The more we use pain medication, the more we have to worry about interactions with other medications, dependencies, as well as the fact that the medications become less effective over time. So there are a number of reasons why patients may be at the point of considering knee replacement surgery. Knee replacements come in different shapes and sizes, and a lot of times it really depends on where your particular arthritis is. We commonly talk about the knee as being three different areas: the inner side, also called the medial side, the outer side, also called the lateral side, as well as the area underneath the kneecap, which we call the patellofemoral region. And a total knee replacement is something that will resurface all three of those areas. Now, if a patient's arthritis is more isolated to only one side, such as the medial side or the area underneath the kneecap, the patellofemoral region, they may be a good candidate for a partial knee replacement. And this is a really attractive option for those patients because it's a much less invasive surgery, it's a smaller incision, there's much less bone that needs to be removed to do the surgery, and they can frequently have a quicker recovery and return to a more active lifestyle. Unfortunately, partial knee replacement might not be appropriate for everyone. If the arthritis has progressed beyond a certain point, then total knee replacement would be the better option. To maximize the recovery after knee replacement surgery, physical therapy is very important. We're very aggressive with our physical therapy. Even the very day after surgery, we try to have patients getting up and walking around. It does require assistance, and we would have a physical therapist help you with that. And most patients are using a walker to start, but over the course of a few weeks, you're able to switch from a walker to a cane, and then ultimately to get rid of the cane. The therapy is really very important though. We want to really work on strengthening of all the quadriceps muscles. We want to strengthen and balance out all the muscles that go across the knee, as well as really maintain a good range of motion. So physical therapy will really be very important to help with maximizing recovery. As part of the physical therapy, we will use our CPM machine, which is a machine that puts the knee through a passive range of motion. We will do aerobic conditioning exercises like a stationary bicycle, walking on a treadmill, as well as some light weights and resistance training. Ultimately, our goal is to get patients back to a very active lifestyle. If you enjoyed playing tennis or golf before surgery, we expect you to be able to do that afterwards. But it does require some work, and it requires a little bit of effort on the part of the patient to get there. At the completion of the recovery from knee replacement surgery, we expect most patients to have essentially a normal lifestyle that was very similar to what they had prior to surgery. Again, if patients enjoyed playing tennis, we expect them to be able to play tennis after knee replacement surgery. If they enjoyed playing golf, we expect them to be able to play golf after knee replacement surgery. We expect patients to be able to go swimming. We expect them to be able to go bicycling, walking, hiking. But the most important thing are those activities of daily living and being able to go out with friends or go out with neighbors or go out with your kids or your grandkids and be a part of their lives and go out on trips with them and not feel that you're not able to do those things. So most of our activities of daily living, we expect most patients to get back to 100%. There are a lot of advances in our technology and in our technique for knee replacement surgery. Over the past decade or 2 decades, there have been a lot of advances both in the strength of materials, the engineering of the materials that we use, as well as in the tools that we use to implant knee replacement surgery. One of the most important advances is in our ability to be more precise with our alignment and our guidance with our knee replacement surgery. One option available to us is to have a CAT scan or an MRI prior to surgery, so that way we can make a three-dimensional model of your knee. And based on that, we know exactly what size component is going to fit in well, and we can make sure that we are able to restore proper alignment and proper balance to the knee. And it's really a more specific approach to each individual based on their particular anatomy and their particular three-dimensional model. There are other advances in our instruments that we use when we perform surgery. We actually have computerized systems that have sensors and levels built into the tools to help us make sure that as we're performing the surgery, we're doing everything in a very precise and reproducible manner, and to make sure that all of the angles that we have to calculate during surgery are as precise as they can be.